early atrial fibrillation study was a randomized study conducted at 18 sites in Canada. Our study was designed to address the question of what should be the best or ideal first-line rhythm control therapy for patients with treatment-naive atrial fibrillation. Our study randomized a little more than 300 patients to first-line catheter ablation using the cryoballoon, or first-line antiarrhythmic drug therapy, which is currently considered the standard of care. All patients had a implantable monitor put under the skin to continuously monitor their cardiac rhythm, and all patients were followed for a year. The group that underwent ablation underwent a standard cryoballoon-based pulmonary vein isolation procedure, so a standard atrial fibrillation ablation. The group randomized to antiarrhythmic drugs had aggressive antiarrhythmic drug titration performed during a 90-day period in order to completely suppress atrial fibrillation. Patients were followed for a year, looking at arrhythmia recurrence endpoints, as well as quality of life and healthcare utilization. What we saw in the study was that ablation was associated with a significant reduction in arrhythmia recurrence. The reduction in absolute terms was 25%, meaning that 4 patients needed to be treated to prevent one recurrence of atrial fibrillation, flutter, or atrial tachyarrhythmia. When we look at symptomatic arrhythmia, 90% of the ablation group and 73% of the antiarrhythmic drug group were free of symptomatic recurrence within a year. If we look at the amount of atrial fibrillation that was recorded on loop recorders, so atrial fibrillation burden, this was in absolute terms reduced by 3.3% between groups, or 1 day less atrial fibrillation per month. In terms of quality of life, patients in both groups significantly improved. However, the magnitude of improvement was substantially better in the ablation group compared to the antiarrhythmic drug group. It was twice the minimally clinically important difference in our quality of life scores. So we used the disease